course, because of that, we have our hopes pinned on the COVID vaccines. Over 7 million South Africans receiving at least one dose of either Pfizer or the J&J vaccine so far. Also, a consignment of over 5 million doses due to arrive in the next few days, which is part of the COVAX donation by the United States. That'll be welcome news to many, but for others, despite the proof that the vaccine saves lives, they remain hesitant, even vehemently opposed. And I'm joined now by vaccinologist Professor Shabir Madhi from Wits University. Prof, thank you so much for joining us. Let's just first look at those figures. We've seen, of course, in the last 2 days that the Western Cape has taken over from Gauteng. The deaths today, 248, which is it's half of what we saw in the previous 2 cycles. It was over 500. Can we read anything in that, or do we have to just keep looking at the 7-day rolling average to understand what is happening with the deaths?
That's good evening, Sally. So that's correct. It's more accurate to look at a 7-day rolling average rather than to do day-to-day comparisons, because I suspect there are some reporting issues which were inflating the number of deaths that were reported over the past 2 days compared with what was reported yesterday. So I think the rolling average is a much more useful metric, but that doesn't detract from the fact that what's currently being experienced is that the Western Cape is still very much on an upward trajectory. KwaZulu-Natal is on an upward trajectory, whereas Gauteng has now turned the curve and they're on a downward trajectory. But what we can expect to occur is that those numbers are going to remain stable, if not increase, over the course of the next 2 to 3 weeks, and particularly more so in the KZN and probably in the Western Cape for at least another week. Another important measure is the positivity rate. And right now, the Western Cape is reporting a positivity rate of close to 32 to 33%, and KZN similarly, or if not higher. So the positivity rate is extremely concerning. That is the percentage of people that are coming forward to be tested, that are testing positive. That's really concerning because we want that figure to be going downwards and to be less than 10%. So we are far away off from that. So we're far out of the woods with this particular resurgences in most of the provinces, other than perhaps Gauteng and to some extent Free State and Northwest.
When will vaccines start making a difference to deaths in South Africa? We know that over 7 million have received one jab. We know that 1 million people are being vaccinated, I think, every 4 days now, which is hitting that 250,000 jabs a day target. How soon is it going to make a difference?
So generally, we start expecting both the Pfizer vaccine as well as the Johnson & Johnson vaccine to start conferring some degree of protection against severe disease at least 14 to 21 days after the first dose, which basically means for the Pfizer vaccine, as an example, the protection after a single dose against severe disease due to the Delta variant is close on to 90%. Now, what that means is that if there's 10 people that were likely to have progressed to severe disease, out of the 10 people, 9 of them won't progress to severe disease, but 1 will still progress to severe disease. And similarly so for the J&J vaccine. So the vaccines start working relatively early. The one big issue that we face in South Africa is we still, as an example, haven't vaccinated 90% of people above the age of 60, who make up most of the cases of death. In addition to which, people under the age of 60, above 35, who have got comorbidities, we're not necessarily vaccinating them. So for the vaccines to be impactful, we really need to ensure that those individuals that do have risk factors for severe disease are the ones that are prioritized. That's not to say we shouldn't offer it to anyone else, but we need to make a concerted effort to ensure that those that do have underlying medical conditions and people above the age of 60, we get a first dose into their arms as quickly as possible. And we want at least 90% of those individuals to be vaccinated before we're going to see some significant impact with the vaccines reducing death and hospitalization. Unfortunately for this particular resurgence, vaccines have come too late, and they'll be much more useful when it comes to a next resurgence that might transpire in the course of the next 3 to 4 months.
So it's such an important point you make. Did you say 90% of people over 60 have not been vaccinated? 90?
No, currently the figure stands at about 65% of people above the age of 60 having been vaccinated. So 1/3 of them have not as yet been vaccinated, which is a problem because they make up close to 50% of all of the people that die of COVID-19 in South Africa.
I understand. So there's 1/3 of those people in that high-risk group that simply haven't had the vaccine. At the same time, we're seeing young people dying. I mean, the incredibly sad news that 47-year-old Shona Ferguson has succumbed to COVID-19. And obviously we don't know if he had comorbidities, and we don't know the particular circumstances. But it's very worrying, because it seems like young people are also susceptible. Do you think Delta is starting to show that it is more virulent, more vicious than previous versions of the virus?
So what Delta has been shown is at least 2 times more infectious than the original virus that was circulating, which means that it's more likely to transmit, and people are more likely to be infected if they do get exposed. There's one small study from Scotland which does indicate it is more virulent. But the reason we're seeing young people die this time around and ending up in hospital is just a function of the much larger number of people that have actually been infected in this particular wave compared with the number of young people that were infected in previous waves, simply because this variant, unfortunately, is much, much more transmissible, and it's much easier to be infected if in an environment where the virus is circulating.
I want to speak to you about anti-vaxxer sentiment. You are a vaccinologist with many, many years' experience. You have seen how it has saved the lives of so many children. It's so crucial. But you turn on the radio and you hear people saying they don't trust the vaccine. It was developed too quickly. It's only been authorized for emergency use. Nobody knows what's in it. I'm not going to take it. Is that, how big is that group, do you think, in South Africa? Because I'm concerned we might be overblowing it. And the vast majority of South Africans will absolutely happily take it. And it's made more difficult when the Ipsos surveys and NIDS-CRAM show us that at least 3/4 of South Africans, and growing, will happily take the vaccine. Afrobarometer comes out this week, a much smaller survey, it has to be admitted, and says about half of South Africans might take it, and the rest put more stock in prayer. So my question to you is, having been in this world for so many years, how big is the anti-vaxxer lobby in South Africa?
Yeah, so I think the anti-vax lobby in South Africa, like in most other places, they are a very vociferous group, but they're really a minority. But at the same time, that doesn't dismiss that there are people that are hesitant to be vaccinated. And those people can be convinced. We as anti-vaxxers, you could do whatever you wish. That's never going to happen. They're not going to change your mind, because the premise from which they start is completely unscientific, and there's no way to actually reason with them. But for those that are hesitant and that do have doubts about safety of the vaccines, or how quickly it was developed as an example being the reason why they're reluctant to be vaccinated, the core message to them is that the toss-up is between getting vaccinated, being protected against COVID-19, despite there being a relatively very small risk of side effects, or remaining unprotected and actually dying of COVID-19, and if not dying from COVID-19, ending up with sequelae which can continue for months, if not years, then time will tell. So you've got a choice to make, and that is, especially if you're in that group of individuals that is at risk of developing severe disease. For me, the mathematics, the equation behind it is quite simple. The benefits of taking a chance with a vaccine which you might have some doubts about, which I don't have any doubts about, far exceeds any sort of risk that you might have in mind when it comes to not receiving the vaccine.
All right. Well, thank you so much for chatting to us this evening. That is vaccinologist Professor Shabir Madhi from Wits University. Let's move to this story now.